Hello, welcome to Primetime Live with Next Level Prime. This is a monthly series meant to let our listeners hear all about all things Next Level Prime. I'm your host, Dr. Karen Rakers. I am Vice President of Next Level Prime. I'm a family medicine physician, and I've been with Next Level for many years now, and I've had the pleasure of managing the Next Level Prime program since it started about 2.5 years ago now. So, just as a reminder for any of our new listeners, Next Level Prime is a really awesome advanced primary care model. We actually contract with employers, and that allows employees and their dependents to have access to unlimited healthcare services at Next Level 7 days a week. We have a virtual care platform, and that is combined with our very large network of physical locations in the Houston, San Antonio, Austin, and Beaumont areas. And care that is provided includes primary care, preventive care, chronic disease management, urgent care, health coaching, and emotional wellness coaching. We also include a care navigator team, a team of nurses that help our patients with their healthcare journey. And they also manage referrals that might be needed. Most common labs are included, routine vaccinations are included. It's a really great program, and all of it is provided at no cost to the employee or to the patient, which means no copays, no deductibles, and no surprise bills. Today, I am just thrilled to have Omar Arif, who is Senior Vice President of Growth at ClaimDoc, on the program with me. Omar has been a terrific vendor partner, and he has brought the Prime program to some clients to help promote deeper healthcare savings. And we're going to have a little conversation here today. So, Omar, thanks for joining me.
Hey, Dr. Rakers. I appreciate you having me on. Thank you.
I want to kind of start the conversation off with a really, the big behemoth really in healthcare. So why are traditional network plans so unaffordable?
I'll try to keep that short. That's a very loaded question. There's a bunch of reasons. The biggest problem that we see in the market today is that the price that's set between the network, which is typically owned by a large insurance company, and the hospitals are egregious in our opinion. And there was a study published recently. It was a multi-year study done by the Rand Corporation. They did a 5-year trend study on hospital prices, and they've concluded that, and the last year they reported on was 2020, and it showed that hospital prices as a percentage of Medicare were now in excess of 2.5 times Medicare. And that was in 2020. We're now in 2023. And if you look at what's happened with the cost of everything that you can buy these days, inflation has really taken off over those last couple of years. So we now estimate that number is more like 3 times Medicare. And so when you go to an employer and say, hey, it doesn't matter if you're fully insured or self-funded, if you're leasing one of these traditional networks, or if your employees are accessing one of these traditional networks for care, you're paying 3 times what the federal government pays for the same service. And if you're a fully insured group, you might say, well, it doesn't really matter. The insurance company is taking the risk, but they're passing that risk on to you in the form of premium. And if you're a larger employer who's self-funded or at least partially self-funded, then you bear that cost with just pure claims reimbursements. And so it's just, it's been on a path for unsustainability for quite some time. I've been doing this for 15 years, and people in the market have said costs are out of control since 2008, and it still exists today. So that to me is the biggest problem in healthcare is the fact that the large health systems are out gobbling up independent practices, and they're setting prices that are, to me, unreasonable.
I could not agree more. I think people finally may be recognizing that this is unsustainable. I think employers are now trying to figure out what they're going to do because they're the ones that are, bearing the brunt of a lot of this cost. So maybe you can tell us about reference-based pricing.
Sure, yeah. Reference-based pricing is a pricing mechanism that simply aims to attack those egregious charges that I just spoke about. So instead of paying a price that's set by a large insurance company and a large hospital system, a contract that you have no access to as an employer, we tend to be price dictators. So we just say, okay, there's already established benchmarks for care. Medicare establishes a benchmark. Hospitals who accept Medicare have to report their cost of services to the federal government. And so that's all public data. So we know what these services are costing providers to perform. And we just set more appropriate reference points that are fair and reasonable to the employers that we serve. So if you can think of us as a price dictator versus a price taker. And then where ClaimDoc goes above and beyond simply repricing claims is that we also provide a ton of advocacy services to make sure that the members and the clients and the members that we serve have access to care outside of a traditional network, which is why innovative physician practices such as Next Level are such great partners for us, because they help us manage those populations.
So just a follow-up question to that. Do you reprice the claims? So you don't actually change the contracted rate that they have with any of those networks. You're just going back after the fact and saying, hey, let's do this a little differently in reference.
No, what we're doing is we're actually completely replacing the network. So we say, hey, don't purchase your healthcare through Blue Cross or United or Cigna, Aetna.
Yep.
Just let's go out and use an independent third-party claims administrator. ClaimDoc will set appropriate prices for care and then help make sure your people know that we can get them into their doctor with our member advocacy services.
And another follow-up to that, how difficult is it to get those providers to agree to do the reference-based pricing model?
It's easier than you think. It's a lot of work.
Mm-hmm.
It's just a lot of legwork to get to the right person at the doctor's office to say, hey, yeah, we can accept this insurance. We will bill the plan. We have a 92% acceptance rate across the country when we proactively reach out with our member advocacy department to say, hey, Dr. Rakers is coming off of a Blue Cross plan and she's coming on to ClaimDoc's open access plan. And here are the 3 physicians that she sees. We're going to reach out to those docs and say, hey, doc, Karen Rakers needs to continue to come see you, but she's not on Blue Cross anymore. She's on ClaimDoc's open access plan. Here's how it works. Here's how we're going to pay you. Here's how quickly we're going to pay you. Will you accept it? So like I said, a 92% acceptance rate across the country. And then in the 8% when a provider says, no, we're not going to accept it, then we go back to the member and educate them like, hey, this particular provider has said that they're not going to bill the health plan. So you have a couple options. We can either find you another physician of the same specialty in your area, or if you're willing to pay the cash rate for services on the spot, then you can just hang on to your receipt and we'll make sure that you get reimbursed later, less your copay or deductible or whatever it may be.
Yeah. And I think I would wager that most physicians that you're working with, they know that the actual cost to deliver that care is not what those contracted rates with major carriers are. So they're probably willing. And also you're making it easier for them, I think, to get paid. Right. So there's
less credentialing involved. Yeah. We're not telling providers how they need to be practicing or where they need to be sending referrals. It's an easier process for them. And on the physician side specifically, a lot of times the way we reimburse physicians is they actually get a pay bump compared to what they're getting from some of the other managed care networks. I was having this very conversation with a friend of mine who's an orthopedic surgeon here in Dallas, and he was mad at me that I hadn't brought this to him sooner because we're friends. And he's like, I'm so sick and tired of dealing with the large payers. Yep. They've cut into our reimbursements. They have, physicians on staff that haven't practiced medicine since the mid-90s, but they feel like it's appropriate for them to tell me how to deliver care. And I'm so sick of it. And so the tides are turning in our favor, I think.
Yep, I agree. Definitely a great option. So let's talk about how then, this type of model, reference-based pricing, can work really well together with a direct primary care type practice.
Well, it works really well for us because, one, physician groups who are doing direct primary care are innovative. They've completely gotten away from the rat race of the fee-for-service model and gone into more of what I would call a value-driven care model. Mm-hmm. And so practices such as Next Level Prime already sort of understand what we're trying to do and what we're trying to accomplish. And so when members can come to them and the employer is paying the bill, and they can come to you for no copay, no hassle. I think Allison likes to say they don't ever have to pull their wallet out. It's a huge value add for the employees of the group. And then where it works really well from my perspective on the reference-based pricing side is your care coordination team will work closely with our advocacy team to make sure that specialist visits go to friendly specialist providers. So if somebody comes in with, something complex that you can't manage in an urgent care environment, or if they need, an orthopedist referral or a cardiology referral, those are going out to the right places. So it's a really neat model that once you get into that DPC, they're gonna direct you to the right place, and it makes the whole experience just a little bit easier to administer. And then it's better from us from a business perspective, where we don't have to call 1,000 different doctors to get this new group set up. We can lean on the locations that you guys have in your markets, and that's really what I love about Next Level is the limitations on DPC are usually geographical limitations, because a doctor in Philadelphia decided he didn't want to be fee for service anymore, but he's only got one office. And you guys have, 50 clinics now?
We're not quite 50. I think we're at 42. Well, how many of we're at 42. So across the Houston, San Antonio, Austin, Beaumont area. So we're got pretty good coverage here in the Texas region. And
the other thing I like about it is you guys now have the telehealth component, so that if somebody's traveling, or if you got a group of 200 people, but 3 of them live in Dallas and you don't have a location in Dallas, they can still access the telehealth services.
That's right. Yes. We are certainly trying to make it as convenient as possible for patients to have access to care.
Dr. Rakers, you there? Did we freeze for a second?
We did have a little glitch there. I think we're back though. So you did mention okay. I hope
you there. Is that me or you? Okay.
I don't know. It's hard to say. Technology is great till it's not, right?
Right.
So I was just mentioning, you kind of talked about administering a plan. So really, I mean, it seems like the Next Level Prime program does make it easier for you to administer this type of plan. I guess, does that kind of fall within the care navigation piece of it? How do you think that is, the most beneficial for the administration of that type of plan?
I think it's twofold. One is that you can go to the population of the group and say, hey, you can go to any of these locations for free, and you get primary care, pediatric care, extended hour urgent care. They've got, they can do lab work and x-rays in every single clinic. When people know they have that comfort of those types of services, it makes it easier transitioning them from Blue Cross, something they've all heard of, to a claim doc plan, which no one has ever heard of. So when we come into Houston and everybody's familiar with you guys down there, you guys have done a great job of branding in that market. Then we say, hey, you can access Next Level, 7 days a week from 9 to 9. That makes it a really clean transition for the members. And then on the back end of that, it is the coordination of care when it needs to go out to specialists. Absolutely.
Yep. How do we as the primary care provider then make sure that we are finding specialists that will partner with the reference-based pricing model?
Yeah, I think, there's two sides to that. One is your doctors probably already have the relationships that they like to refer to. And so I believe we just started using the referral system that you guys have in-house, which is great. I actually just became privy to that a couple of weeks ago. So I think that's awesome. And then the other side of that coin is we've got some clients in your markets that maybe don't access Next Level. So we've already built out provider relationships in Houston, Austin, San Antonio. So we have lists that we can provide to say, hey, look, in Round Rock, we've worked with this group of physicians, or in San Antonio, we've worked with this group. And if you would refer here, that would make things go a lot smoother. So I think that type of back end coordination is really tough to beat. It does take a lot of work to make these plans go well. It's not perfect, but the savings that we can generate for an employer and for their people, I think make it worthwhile.
Yeah, absolutely. I think putting the legwork in certainly is going to be worth it when we're talking about curbing some of this rising healthcare cost. It's just, again, it's unsustainable. So, I mean, along those lines, I guess, what are the typical cost savings that you can see with a partnership like this for the employer side first, I guess?
Yeah, I think, just as a blanket average, we've generally gone to the market and said, we're going to save your plan 25 to 35% off your overall healthcare spend. We just released a study on our book of business from last year that actually shows it was a lot higher than that. It was more like in the high 30s, some parts of the country, even in the low 40s. So I get that this is a little bit unfamiliar. It's massive.
I mean,
yeah,
that's huge.
Well, yeah. And we understand that this is a completely different way to finance healthcare for your entire organization, and it's not for everybody. If you're a law firm with a really high 6-figure average salary and you don't want to mess with it, we get it. We're not trying to sell this to you, but for most organizations, the savings is worth the change, in our opinion. I mean, are there going to be hiccups along the way? Absolutely, there are. But when we're talking about going to an employer and saving them hundreds of thousands or even several $1 million in certain cases, then are the few headaches worth that savings? And usually the answer is yes, because it's really not just about saving the employer a bunch of money. It's about delivering the rank and file employee a better program. So when I can go to them and say, hey, let's not only save you, Mr. CFO, a bunch of money, but let's give your people free access to care through Next Level Prime. Let's also lower their deductible. Let's also lower their payroll deduction so that everybody in your entire organization gets a raise, and you're still going to save 20%. How's that sound? Then it becomes more a conversation of this is now a retention tool. This is now a culture play for our entire organization. This isn't just a benefit. We just had a group in Minnesota with a couple thousand employees, and they're really well paid. It's a really well paid group, and they're spread out all over the country. But they got another 16% increase from Blue Cross, and they just were not willing to take it. They did everything they could last year.
And that's just for the premiums. That's not even the cost of the services delivered. Yes.
Yeah. So what we went in and did was we said, okay, let's lower everybody's contribution by 10%. Let's lower the deductibles across all plan designs, and let's make this feel like it's something we're doing for the entire employee population, not to them, but for them. So the story for the HR folks who are really on the front line is like, hey, look, here we're going to do something a little bit different, and here's what you get for taking the extra steps and being willing to make the change.
You talked a lot about, obviously great for employers. You mentioned, advantages also for the employees. So, what do you see? How big of an impact is this for the working class? These combined, solutions. What are we seeing on the patient side, on the employee side?
Yeah, I probably don't see the full breadth of how it impacts members because I'm not a clinician, and so you may be able to answer that your own question better than me. But I'll tell you just from a financial side. I tell this story to people all the time that will listen to me, but we've picked up a group in East Texas from a large carrier, and the group I personally handled the group meetings to make sure we were educating people the right way, but they were a blue collar group, a couple hundred employees, and the family rate on that plan was going to was going to go down to the member, to the employee. The family rate was going to be reduced by $700 a month. And so I remember in one of the group meetings, this big burly truck driver with a long gray beard, he looked like he just got off of his Harley Davidson. When we told him that his pay was just going to increase by $700 a month because that's how big of a discount he was going to get, he thought we were lying to him. He didn't think that was possible. And when he kind of came to the realization that, no, it's real, like your family's now got an extra $700 a month, he started crying. I'm talking big, burly, Harley Davidson truck driver is crying in a benefits meeting because he just got a huge raise and he didn't see it coming. He probably walked into the meeting thinking he was going to have to, pay another increase. And so, we've got a lot of stories like that all around the country. And that's why I'm so in love with y'all's model. I mean, it's impactful.
Those are significant amounts of money for people. It's a huge amount. I will say, just from our perspective, what we see on our side that I am always excited about, we ask people where they would have gone for care if they hadn't been able to come to Next Level. And again, they're coming to us under this program for nothing, right? They're not paying copays and deductibles, no out-of-pocket cost. We get about over 20%, upwards of 25% in some of our client groups that say they would have gone nowhere. And so again, you're thinking all these people that were just going to not go anywhere for care, because even though they've already paid for the premiums with their health plan, it costs them more, and maybe it was inconvenient and all the other things, but now they're coming. So
yeah, I mean, that blows my mind. In the wealthiest country that has ever been, people will forego care because they can't afford it. And that's to me, on my side of the business, that's what gets lost a lot of times is, I deal with a lot of C-level executives. I deal with a lot of, even like VPs of HR that are paid pretty well, and a lot of insurance brokers that make a really good living. And we tend to forget about, the manufacturer who's living check to check, or the teacher who's trying to provide for a family. Like it's a different ballgame for some of them. And if you can't help them out, then what are we doing?
Well, and I think the other point about that, really people talk and they're focused so much on the health plan. Like they're talking about the health plan that they're going to offer, and they forget that actually doesn't equal health care, right? So having a plan does not mean people are actually going to get care. So I think this gives people that opportunity to actually get health care. So, I've heard all the amazing things. It's great for employers, great for the patients. Why are more brokers not offering this type of model?
Well, I'm sorry, my computer froze, so I'm like trying to crank it back up so I can look at it.
Yeah.
All right. Yeah, that's the $1 million question, Dr. Akers. You have to think about it this way: like these agencies that offer benefits to employers, they're businesses too, and they've got to protect their business model, their revenue model, their workload. And so there's a lot of factors in play here, because you got to understand that they're used to collecting commissions from the big carriers, Blue Cross, United, Cigna, Aetna. They're used to getting bonuses from those carriers, and so to do something different is not only going to be a potential revenue hit. We try to make sure it's not a revenue hit, but it's a potential revenue hit to the broker. But then it's also a potential increase in workload to the broker, and so if they can get away with negotiating a 20% United Healthcare renewal down to 5%, then they're going to take the path of least resistance and walk away. And I can't always blame them for it, because I do know how much work is involved in doing a program like ours. But I just think the impact that it can have is it far exceeds the work that's got to be done. But it's absolutely not a set it and forget it plan. The communication that has to go out has to be consistent and frequent, and it's got to be done right so that people aren't confused, so that people know that they've got resources they can lean on for help. But yeah, I mean, most brokers that we talk to are never going to do business with us, and it's a shame. But we're constantly out there spreading the word anyway.
Well, one of these days, everybody's going to get on board, right?
Right.
So you mentioned several times, the partnership between ClaimDoc and Next Level Prime. It sounds like you're a fan. I wonder what you think sets Prime apart from other DPC practices that you've worked with.
Yeah, I think that you guys have, from the top down, you guys have really done a great job of being thoughtful about how and when and why you're going to roll out. So your technology is there, your locations are there, the services are there, the communication is there. You guys are just at the forefront, and I've done business with, gosh, at least a dozen different direct primary care groups. And they all have their different models. And now there's even direct primary care aggregators that are putting deals together for large groups that have people all over the place. And so the name of that group is Peak Med. So we work with them quite a bit. But from a
Yep.
one practice perspective, there's only one other group that I think has anything close to what you guys have. It's a group out of Chicago called Imagine MD. And I think they have 7 or 8 locations in the Chicagoland area, and they do a wonderful job. But those are the two that I'm just absolutely in love with. I think it's the gold standard for group healthcare moving forward. I think eventually everyone's going to be doing some version of it, and I think you guys are like out at the forefront of innovation for sure.
Well, I appreciate that. We've definitely tried to certainly be thoughtful in what we've put together, and really just want to make a difference. I think goal as you have with just providing great care, doing it, at a better cost, lower cost, and being efficient, taking care of
Yeah,
patients.
the services are right, the price is right. I think you guys are just doing a fantastic job.
Awesome. Well, thank you. I very much appreciate you joining us today. And, we're right at close to 1:30. So we'll go ahead and end this session of Primetime Live and see everybody again next month.
Thanks again for having me.